Hello friends, welcome to REVERT Hair Transplant Center Dehradun YouTube channel. I'm Dr. Amit Singh and I'm a hair transplant surgeon based in Dehradun. In today's video, I'm going to tell you the special precautions and the modifications we do at our clinic REVERT so that we can give the best result that is possible in a hair transplant. First of all, we do every hair transplant procedure in our clinic by DHI method. DHI hair transplant technique is presently the latest technique, and whichever clinic is established world over in the field of hair transplant, majority of them have adopted DHI technique in their clinics. Why DHI method is considered the best hair transplant technique? There are three clear-cut advantages with DHI. First is more hair roots can be transplanted in a single day session. Most of the roots, up to 99% of the roots at our clinic, are usually survive and are not damaged by DHI. And the third advantage is that the final result of an hair transplant is absolutely the natural. It gives absolutely natural looks. Even the person who is getting the hair transplant will not be able to make out whether the roots that he is seeing on his scalp is the transplanted root or that root was present previously on his scalp. The results are absolutely natural. We do every hair transplant by DHI. Besides the routine method, we have made certain modifications in DHI also in our clinic so that we can improve our results. To get a good results, there are certain things we have to keep in our mind. The first and the most important is that every hair transplant procedure should be completed in a time duration of 6 to 8 hours. Why is it so? Because if we take out the hair roots and put them in a solution for a longer duration, the more time we take in putting them back or in implanting them back into the scalp, the roots extracted will start dying, because we are cutting the blood supply of those roots, and the more time we will take in transplanting them, the more damage it will occur on those roots. So to make sure that we don't damage the roots, while extracting the roots, when I do all the extractions personally by myself. I don't allocate the extraction part to any staff. I do every extraction since the last 12 years myself only. And the modification I do while extraction is that I do all the punches simultaneously. We don't take out the roots previously, and in the traditional DHI method also, when we start extraction, we used to punch few of the around 10% of the roots, and then we used to take them out and put them into the solution. But now, since the last 1.5 years, I am punching all the roots simultaneously. We don't take them out only after completing all the punches. Around 3000 to 3500 follicular units or punch can be made in a single day session. I do all the punches simultaneously, and after I have completed the step, then only we take the roots out of the scalp. This prevention makes sure that the roots stay hydrated, they are not cut off from the blood supply, and they are not damaged. The other precaution we make, the other step is, when we have taken out the roots, we have to implant them back into this area where the patient has baldness. We do implantation method by using special instruments which are called implanters. Implanters are a pen-shaped instrument where we insert the roots, we put the roots inside the implanter, and that implanter has a tip, has a button over that the implanter, and the staff just have to take that implanter over that area and just push the button above. The roots are automatically pushed into the skin. The staff doesn't have to hold that root, and automatically the implanter punch comes out and the roots is inserted at the perfect level where it is required to be implanted. So we don't damage the root while they are inserted into the scalp. So we make sure at every step that roots are not damaged and most of the root survive and grow. So we take special precautions while extracting the roots and also while implanting them. This makes sure that we at REVERT, we make sure that around 95 to 99% of the hair roots survives. This thing is very important because in most of the clinics, the extraction as well as the implantation part are not done by the doctor. The technicians, the compounders or untrained staff is doing the procedure. In REVERT, the punch part, the extraction part is personally done by me. I only give the local anesthesia. I only anesthetize the skin. Personally, the anesthesia is given by me only, and before implanting the roots in the scalp, the design of the hairline, the density, the angle of the hair roots is personally done by me. My staff, just the work of my staff is just to insert the roots that are punched that are extracted by me into the holes or slits with the help of implanters. So 95% of the procedure is personally done by me. Most of the clinics are not following this protocol. All the procedures, all the steps are allotted to technicians, and they are doing 99.9 or up to 100% of the procedure by themselves only. Doctors are not coming to the operation theaters to monitor even, and that creates the chances of complications, poor results, and the precautions that are required during a procedure, they are not usually met. So these things are very important for you to know before finalizing your hair transplant at any clinic. So whenever you plan to get a transplant at any clinic, you first visit that clinic, meet the doctor who will be performing your hair transplant, make sure that the doctor only performs all the critical steps, and the procedure, the method for hair transplant should be the latest. Most preferably it should be a DHI method only. I am sure that through this video I am able to explain the importance of a doctor himself or herself performing the procedure. This is the most critical part to get a good result and to make the hair transplant procedure safe. If you want further information regarding hair transplant and other hair loss procedure, you kindly subscribe to this channel. If you have certain specific queries, you write that query in our comment section. This is Dr. Amit Singh signing off.